And I'm here with Daniela of the Medical League. Thank you very much for coming.
Absolutely delighted being here. Thank you for inviting us.
Okay. So could you tell me a little bit about what it is that you guys do?
Really difficult to summarize, but I'm going to try to do that because we've been existing now for almost 6 years, and initially started as a collaboration between Dr. Benson and myself to try to support doctors through the appraisal and revalidation, especially when it comes to locum doctors. So both of us, we come from clinical backgrounds. We're still working clinically, and we had that experience. We knew the guidance, and we decided to build an IT system that is best designed to support doctors. And it all started from there, initially with the appraisal, with the revalidation. I was the RO, the responsible officer for the company, and at the same time, part of being a medical director alongside Dr. Benson. So it started with the appraisal and revalidation, initially for doctors, so we were known as, the Doctors League, and then expanded into trying to support as much as possible all clinical staff, including nurses, through their process. And then part of the IT development, we tried to make completely user-friendly, so doctor had access to their appraisals on their phone rather than log in. And as it grew and developed, and we supported doctors, we realized that there is that massive need of the medical legal cover. And Dr. Benson has, extensive experience in this field. And then it developed the Medical League as an protection for doctors, but mainly for all clinical staff.
Okay. And what are some of the reasons behind the need for legal protection and services for doctors and other healthcare professionals?
So that need always been there, and every practitioner has that sort of, indemnity cover. Nevertheless, what it transpired is that you can pay for a subscription with the cover and not necessarily agreeing for them to represent you in times of need. And therefore, we wanted to have that sort of, insurance-like approach, and to be open and transparent with all pretty much, clinicians from that angle. Like when you discuss about, insurance, we all have insurance for our cars, we all have insurance for our homes, we all have insurance at times for our phone. So why not insurance for actually the profession that keeps you going and keeps you working? And again, we just wanted to offer that transparency, honesty, and support to all clinicians. And the beauty of what we designed, we just wanted to merge the clinical needs at the same time with any contract, employment needs as well. So merge them under the same company. So what we wanted, and actually we've delivered and we will continue to deliver, is having a company that serves everything from appraisal to revalidation to medical legal cover to then pursuing more with education, personal development, just to ensure that the person comes to one company for all their needs.
Okay, great. And in your own words, what do you think it is that sets the Medical League apart from others?
We're clinicians for clinicians, and I think we put the person's welfare, mental health, being a professional conduct above everything else. So we are clinicians working for the clinicians. We know what that entails, and we just want to keep this going because, in fairness, we all need each other.
Okay, wonderful. That's great. And do you have any future plans for the practice?
I don't think we'll ever stop from that perspective. So yeah, I think first of all, it's just, raising the awareness because unfortunately a lot of clinical staff, they pay for the indemnity not knowing that they might not necessarily be represented. So it's still, raising that awareness, supporting them, getting more people registered with us. Ensuring good clinical practice because everyone benefits from that, from the clinician to, the patient, to the wider service. And we want to continue further when it comes to, developing IT products and more education.
Okay, wonderful. Well, congratulations again on winning your award, and thank you for being here.
Thank you so much. Absolutely a delight.